beginning, what we do is we do counseling for individuals, couples, and families. And what we focus on is face-to-face interaction with our clients. But once the COVID-19 came into full force and we were closing down buildings and the city and all the communities that we serve, we needed to do a new platform, an electronic platform, so that we could continue to serve our families and the individuals that are already our clients. But we knew we needed to reach out and make sure that there were other individuals who were being impacted by this. Although it's a physical ailment and public health crisis, it really affects people in so many different ways, through isolation that they may be experiencing, just stress of being home, stress of job loss, family illnesses, being home with families. And so part of what we're doing is serving our community by being able to do telecounseling so that they can still receive our services, but not have to do that face-to-face, but they're still being able to receive mental health counseling. It's a different way for us to work, and so we've had to adapt to that. Many of our clients have been court-mandated violence, crime victims. We also serve juvenile court. We serve young people through school systems. And with all those being changed, our clientele has gone down in terms of the financial benefits that we receive from some of those services. So we're not able to utilize all of our grant funds that we receive because we're not being able to serve as many individuals in those specific areas. But what we are able to do is add new clients and see people that perhaps we have been missing in our community because of this. So we're able to see more people and new people in a way that we haven't been able to do before. Well, certainly financial support is necessary to keep our operation going. We are an agency that serves people of moderate to low income typically, and so we charge very little for our services, if anything at all. And that's really based on a sliding fee. And so it's based on people's income, the number of people in the household. And so we don't expect our clients to be paying us. And so financially, that has been a big strain for us. And so the support from this recovery effort that United Way and the Community Foundation put together has really helped us, and they've really helped prop us up and provide us with the platform that we needed to get online. A new program it's not a new program, but something we're launching this coming month in May is we offer a course called Families in Transition. And it's really for families learning to co-parent as they're going through divorce. And what we're going to do, and we've always taught that in a classroom setting, and so we're very excited that we're going to be able to shift a little bit, and we're bringing that online. We're going to have a virtual classroom so we can continue to offer that program. And that's brand new for us to be able to deliver our service that way, but we are very excited. I think one of the things I would also tell you is I have a wonderful staff. I'm very privileged that way. They're thinking, they're helping me think through things as, that's a great idea, but what's all the process behind it? And they have just been fabulous. The counselors are on top of their clients. They're working with them. The feedback I'm getting is they've had some really great sessions with people. So they've adapted very well, and that flexibility is just critical. Well, I think spread the word. That's one of the things, tell people that we're available. The Family Counseling Center of Central Georgia, we are available to take new clients. If you know someone who's struggling right now emotionally because of the stress, because of job loss, because of medical issues in their family or loss of a friend or family member, that's what we do, and we do it very well. And we want to be there to support people. So referring people to us so that we can serve them We serve the entire Central Georgia area, so we want to help individuals, and really the telecounseling makes it a lot easier for people. They don't have to travel to one of our 3 locations. They can do this from their home. They can go sit in their car and have a counseling session that's private for them. And so really, if the community could help us by referring clients, that would be wonderful. And also donating then to the COVID-19 recovery fund that is being established, because we are one of many agencies that's really on the front line now, really wanting to help individuals. Many of our other nonprofit organizations are actually out there working with individuals and putting their own health and safety at risk. And so we really feel like we want to support our nonprofit partners as well and help them if they need any counseling services or anything as well. United Way is such a wonderful agency. They really look very broadly at the needs of our community. The needs that are, whether they're food needs, through all the way to us, which is counseling needs. And so they really look very broadly at what each community needs at any specific time. And what I love is that the United Way, as well as the Community Foundation, have pulled all these nonprofit organizations together, and they're listening to what the needs are, because those needs have changed. Our day-to-day work has changed, and it will change probably, for some time. And so how we deliver our services has changed. And so United Way looks at all of those things and looks at all of the changes that are happening, and they look at how they can influence and help and improve service to our community. And I think that's the most valuable thing that they offer, is that broad look at how they can serve and how they can influence and help make change in our community. Those locations, we have one in Macon, which is on MLK Boulevard in the Peyton Anderson building. We have an office in Warner Robins on Olympia Drive. And then we have a office in Gray, which is right on in the Clinton. It's on Clinton Road. Okay.